everyone, my name is Dr. Lindsey Zubritsky and I'm a board-certified dermatologist. Today I'm going to talk to you about my morning skincare routine while pregnant. So I recently just gave birth to our first child, a little baby girl. So I've had 9 months to perfect the skincare routine of someone who's pregnant. So I'll tell you a little bit about myself and my background. I'm a board-certified dermatologist practicing in Pittsburgh, Pennsylvania in private practice. I am part of the social media team for the American Academy of Dermatology, which is the governing body for all board-certified dermatologists, as well as an editor on the editorial board of the Journal of the American Academy of Dermatology, which is the journal that has the highest impact factor for all things dermatology related. So pregnancy can be a very tricky time for your skin. There are a lot of products that are off limits while pregnant. A lot of them are staples in our skincare routine and something that we use without even thinking twice about. Something like a retinol or a retinoid or hydroquinone. Another issue with pregnancy is that the hormone fluctuation in our bodies can lead to many skin issues that we may have never had before. Me, for example, during my pregnancy, I typically don't struggle with acne or perioral dermatitis or rosacea, and I had a flare of all three of those things. The hormones in our body when we're pregnant fluctuate and are all over the place. So one trimester, you may be breaking out. The next trimester, you may be clear. You may have had acne before and then you get pregnant and it goes away. Or you've never had acne in your life, you get pregnant and you break out like crazy. So it can be a really frustrating time, and I'm here to help guide you through what's worked for me. So in general, I would say my skin type is normal, but I do suffer every now and then from a combination type skin where some areas of my skin are dry and sensitive and some areas of my skin are a little bit oily. And I do live in an area of the country where the weather fluctuates quite a bit. So in the wintertime, it can drop down and be very cold. In the summer, it can get really humid. So I'm constantly having to change up my skincare routine in order for my skin to look its best and be its healthiest. I also tend to suffer, especially during this pregnancy, from hormonal acne. So I tend to develop some cysts, nodules, pimples around my jawline, and then that tends to leave behind post-inflammatory hyperpigmentation. So throughout my pregnancy, I've had to come up with some creative ways to treat that hormonal acne and the post-inflammatory hyperpigmentation, because many of the products that I usually recommend for my non-pregnant patients are off limits during pregnancy, like spironolactone, doxycycline, and retinoids. So I'm going to walk you through step by step my morning skincare routine for someone who's pregnant. So I just want to start out by saying anytime you use a product while you're pregnant or you're breastfeeding, it's best to ask your dermatologist or your OB-GYN whether or not that product is safe for you. So obviously when you wake up first thing in the morning, you have no makeup on, just like this. So rule number one to good skincare is to make sure that you go to bed every night with a clean face. So you never want to be sleeping with a face full of makeup because that just leads to trouble. So in the morning, the first step that I do is to wash my face. So before I go into that, I want to just say that not everyone has to wash their face every morning with a cleanser. If you cleanse at nighttime, and especially if you do a double cleanse, that usually is sufficient for washing your face. In the morning, you can just use water if that's what's right for your skin. However, I use a salicylic acid-based cleanser every morning because during my pregnancy, I have been struggling with some adult female hormonal acne and some blackheads and whiteheads. So I've opted during my pregnancy to use a salicylic acid-based cleanser. So I am using the Inky List Salicylic Acid Cleanser here. It's a nice kind of jelly texture here. So just add a bit of water to that cleanser and then really start to massage it into the skin there. So obviously you want to get it everywhere. And another important thing to bring up is if you get acne or you get chest acne, salicylic acid cleanser is an awesome product to use on your skin here. So yeah, it's really kind of getting in there, cleaning up my skin. So give me a second, let's wash this off. So a few things I want to tell you about using a salicylic acid product. First, if you have sensitive skin, like a lot of people do during pregnancy, it might not be the best option for you. This is really good for people with excess oil on their skin, excess sebum production, those who are acne prone, have a lot of oil in their T-zones, those who get blackheads and whiteheads. So the way that I like to use my product is I kind of suds it, lather it up onto the skin. I let it sit for about a minute or even a few minutes to really take effect. It's called short contact therapy, and then I rinse it away. So the benefit to using a salicylic acid cleanser is that it really only touches the skin for a little bit of time. So as opposed to a leave-on treatment, which sits on your skin all day, which can lead to more irritation and dryness. So the benefits of salicylic acid is that it is a beta hydroxy acid, which is a gentle chemical exfoliant that helps to reduce sebum production, excess oil. It is oil soluble as opposed to alpha hydroxy acids, which are water soluble. So it really can get in and mix with the oil on your skin and kind of cut through that really good and clear out your pores, unclog your pores. Salicylic acid can also help to break up the bonds between the skin cells, which is really good for getting rid of dead skin cells on the skin. So another important thing to know about using salicylic acid in pregnancy is that it's only safe to use if it's 2% or less. So a lot of different sources might say different things about using salicylic acid on the skin. Some sources might say it's not safe to use, while others say it's totally safe to use. As a board certified dermatologist, I go off of evidence-based medicine, and there's no evidence to support that a low concentration or 2% less of salicylic acid is dangerous or harmful to the fetus. So according to the AAD, which is the governing body of dermatologists, as well as the ACOG, which is the governing body of obstetrics and gynecology, it is safe to use a 2% or less salicylic acid in your skincare regimen. So the next step after washing my face is I apply a hyaluronic acid serum. I'm using the Vichy Lift Active Supreme. So as you can see, it's a thicker serum here, and the way to use it is you turn it upside down, which is kind of cool, and you put 2 to 3 drops into your palm. And you can see here it's a little bit thicker of a texture, which is what you would expect with hyaluronic acid. So you just want to make sure you get this kind of all over the face and the neck. And the reason that I use and I love hyaluronic acid is because it instantly plumps your skin. So it's best to apply your hyaluronic acid serum immediately after washing your face. So when your skin is damp, that's when it's really going to absorb that hyaluronic acid and work the best. So the next step in my morning pregnancy skincare routine is an antioxidant serum. So here you can see I'm using the SkinCeuticals Floritin CF. This is an absolute favorite of mine. I've been using the SkinCeuticals antioxidant serum for years. So yes, it is a bit pricey, I get it. It can break the bank, but good thing to know about this, it does last several months when used appropriately. So antioxidants, especially those with vitamin C, tend to be very difficult to formulate. So when they're not formulated properly, they just don't work, and they could even be dangerous and harmful to your skin if they're releasing or emitting oxidation on your skin. So be careful about what antioxidant serum that you choose. And this is one of the times that I do recommend splurging a little bit on your skincare product. As you can see here, it is a nice little yellow color. So here you can see it's just a nice thin texture. And then you just kind of put it all over. Make sure you're getting everywhere. Never ever forget the neck. That's super important to get the neck, because a lot of people forget that, and that definitely gives away your age. You can even get on your ears too. So when you're looking for a vitamin C serum, I opted to go with the Floritin one as opposed to the other ones that SkinCeuticals offer. And there's a few reasons for this. One, this is one of the best serums for aging skin. Second, it's because this is the best one for hyperpigmentation. So a lot of women, especially when they're pregnant, can develop hyperpigmentation, blemishes, or melasma. Melasma is also called the mask of pregnancy, and that's when you get brown, ill-defined, hyperpigmented patches, mostly on the forehead, the cheeks, the nose, the upper lip that kind of looks like a mustache. So that can be very difficult to treat. This does contain 2% Floritin. It also contains 10% of pure vitamin C L-ascorbic acid, as well as 0.5% of the ferulic acid. So the Floritin is the key ingredient that helps with discoloration. And then of course, using a vitamin C and an antioxidant serum in the morning is crucial to anti-aging because it protects against environmental aggressors, it protects against infrared light, UV light, and pollution. So this is an absolute must use for almost anybody, regardless of what your goal is in a skincare regimen. It's good for those who are trying to prevent aging, those who are trying to reverse aging, those who are trying to treat or prevent discoloration or hyperpigmentation. You don't need a lot in your skincare regimen, but this is one of the main things that you definitely should incorporate every day. So as I mentioned, I have had some acne during my pregnancy, as well as a little bit of melasma and hyperpigmentation. So the best product for this, and the one that all dermatologists absolutely love for pregnancy, and one that is considered very safe in pregnancy, is azelaic acid. So this is a powerhouse ingredient. I'm using Naturium's azelaic acid 10%. I use this twice a day, so I also use this in my evening regimen as well. So when you're using this product here, you want to make sure you shake it up before you use it, and then you'll just take, oh, it's so beautiful. I just love it so much. Some people will put it on directly like this, but I'm more old school and I put it in the palm of my hand. So you don't need a ton of it. It's a clear liquid, a little bit firmer of a texture here. You want to make sure that you're putting it all over your face. And then don't forget the neck. If you can take anything else away from this video, you never want to forget the neck, and then your chest too, if that's going to be exposed. A lot of people forget to do their neck and chest, and again, that really kind of gives away your actual real age. So as I mentioned, this is a super ingredient. I absolutely love it, and I think that it's very underrated when it comes to skincare. So it is a dicarboxylic acid, and it is a gentle chemical exfoliant, but it has a lot of other benefits to it as well. So it is comedolatic, so it helps to break up acne spots. It's keratolytic, it's anti-inflammatory, and it's an antioxidant. So because it's all of those things, it also treats a lot of things. So it helps with acne, and it's also awesome for those who have rosacea, and it's really amazing for hyperpigmentation and melasma. So if you were paying attention before, I had mentioned using hydroquinone for lightening your skin. Well, you can't do that when you're pregnant. Another thing that you typically can use to lighten your skin if you have blemishes or dark spots is tretinoin, a retinoid, or a retinol. So that is also not safe to use during pregnancy. So you need to find an alternative, and azelaic acid is the answer. So now that you've put all of your active ingredients on and all those products are working real well on your skin, you want to kind of finish everything off by sealing that in with a moisturizer. So I really like this CeraVe moisturizing cream. So it's super affordable. It's available at any drugstore. It's definitely something that's effective and works well and fits within almost everyone's budget. So here you can see it's just what you would expect with a moisturizer. So it's not super thick, it's not super thin, it's just right. You want to make sure you get everything locked in there. You want to make sure when you're doing your skincare regimen that you're layering your products from thinnest to thickest. So you want the thinnest and most active ingredients as close to your skin as possible. And then you want thicker things like your moisturizers or ointments on top of your skin to really lock in that hydration and moisturizer. So it goes on really nice, and my skin feels super hydrated after using this product. I really like that this product contains 3 essential ceramides as well as hyaluronic acid. I don't necessarily need that because I already put it on in the morning, but oh, it feels so good on my skin. And the last, but absolutely definitely not the least part of my skincare regimen, and what absolutely needs to be the last step in your skincare regimen, regardless if you're a male, a female, you're pregnant, you're not pregnant, you're 15 years old, or you're 80 years old, you need to be using sunscreen every single day, regardless of the weather, whether it's raining, snowing, sunny, not sunny, or you're not even going outdoors for very long, you need to use sunscreen. Even if you're just hopping in the car for a quick drive, you need sunscreen, because UV rays can actually make it through the windows in your house or in your car. And those are the UVA rays, which can accelerate aging as well as cause skin cancer. My absolute favorite sunscreen is the Color Science Unforgettable Total Protection Face Shield. So this comes in 3 different types. So there's the regular one, there's the glow one that I use here, and then there's a bronze one. So what I like about this product is that it works for all skin types and skin colors. So this is a 100% mineral-based product. So there's a lot of controversy with sunscreens, whether they're chemical or mineral-based. So there was a study that came out that showed that chemical sunscreens, when applied head to toe multiple times a day in a human subject, were found in the bloodstream. So some of those chemical ingredients were found in the bloodstream. So what does that mean? It doesn't necessarily mean anything. Just because it was found in the bloodstream doesn't mean that it was causing any harm to the person who was using it, but there's just not enough information to know what that means and what to do with it. So for that reason, if you're pregnant, or if you're breastfeeding, or if you have a kid, or if you're just worried in general at all, I recommend using a 100% mineral-based sunscreen. This product here does not leave a white cast. If you have a darker skin tone, you're a skin of color, I would recommend the bronze one. That goes in really nicely. It does not leave a white cast. The reason that I really like the glow one is because it has a natural subtle tint to it, and it leaves your skin with a beautiful sheen and shine that kind of looks like you have highlighter on. So the reason that I like tinted sunscreens like this is because I can put it on and I don't have to put any other kind of makeup on, which is super important when you're wearing masks all day like I do. And as you can see here, it is so pretty. It kind of even looks like foundation a little bit, and just watch me apply it. You'll see there's absolutely no white cast, and this product has zinc oxide 12% in it, so you might be weary of that, but this one just goes on so beautifully, and it even works again for all skin types. You can see this beautiful glow that it leaves on my skin. So this is really nice. I just wear this as my makeup as well, and I go to work and I don't break out. So you don't want to forget when you're applying your sunscreen, high risk areas like the nose. You don't want to forget the eyelids. It's really important because those are actually areas that are high risk for developing skin cancer. So another area that people tend to forget, again, back to the neck. So you don't want to forget that. I've seen a lot of skin cancers there. And also the ears are crucial, because I've seen skin cancers there. And then back of the hand. So I know we're talking about your face here, but if you're already putting sunscreen on your face, just put the leftover ones right on the back of your hands. So because I'm pregnant, and for anyone who is pregnant, I recommend holding off on any cosmetic procedures during those 9 months. I also recommend holding off while you're breastfeeding as well. A lot of the procedures that we offer in clinic are not safe for pregnant patients. This really is just purely based on the fact that we don't have a lot of evidence, because a lot of researchers don't want to test chemical peels or devices or other cosmetic procedures which are considered elective on a pregnant patient, because if there was a poor outcome, that would affect an unborn baby, which no one wants to test that on. So for that reason, I recommend holding off on almost all cosmetic procedures or elective procedures until after you give birth. So full disclosure, when I wasn't pregnant, I was getting routine neurotoxin injections such as Botox or Dysport between every 3 to 4 months. I would get those in my forehead, my glabella, in between my eyebrows there, around my eyes, and I've also gotten my masseters injected to help slim my face. I've also been a big fan and advocate of microneedling with PRP. That has really helped to increase the collagen production in my skin and to help with fine lines and to make my skin just look more youthful. So of course, I haven't been doing those procedures while I'm pregnant, so I've really had to focus on my skincare regimen, which is protection against environmental aggressors and UV rays to help slow and stop the aging process, as well as other active ingredients like azelaic acid and salicylic acid to help with my acne and skin tone and texture. So I wanted to thank you all for joining me in my morning skincare routine. Again, my name is Dr. Lindsey Zubritsky, and I am a board certified dermatologist, and I am passionate about skincare. If you have any questions or you're interested in skincare or skincare during pregnancy, please feel free to follow me on Instagram and TikTok at Derm Guru on both social platforms. Thank you again for tuning in, and I hope you guys learned something today.